my name is Olivia Krueger, and I am a Concordia University undergraduate in the Psychology and Social Science program. I'm here with Dr. Mazius today, and I'm going to be interviewing him to help promote and spread awareness about suicide. So, welcome.
Thank you for having me. Thank you for interviewing me. I appreciate it.
Yeah. We're going to first start this out. I just want to ask you, how can a parent detect suicidal ideations? Like, what are some of the warning signs they should look for when they're assessing their child or looking at their child?
Okay. So, suicidality, is if it's associated with any feelings, it's probably associated mostly with depression and or anxiety. And it's sometimes difficult to kind of know if your adolescent child is depressed and or anxious, because adolescents by definition can be moody, easily annoyed, sleep deprived, stressed.
Mm-hmm.
But I think, if you're a parent of an adolescent and you're thinking that, just something is perhaps up with your child, and your gut tells you, because we do kind of want to rely on our gut, when it comes to lots of things, but maybe especially our kids. If you're just sort of wondering if your child is more than just like down in the dumps and or overly stressed about life, it's really important that you ask him or her a direct question, like, this may be, I may be way off about this, but I'm wondering, like, you just don't seem like yourself lately. I mean, are you depressed? Are you feeling highly anxious? And so you want to kind of give the child that kind of opportunity to at least start there.
Mm-hmm.
So that's what I would do for starters. And then from that, if he or she is willing to talk to you, if, again, your gut sort of wonders, or gets you to wonder, is there something more than just kind of like fleeting sadness? Like, is there even the potential for suicidal thinking or suicidal ideation? You want to ask.
Mm-hmm.
You want to be real direct about it. Like, I'm just sort of wondering, again, like, you may think I'm like completely misperceiving you, but I just sort of wonder, like, have you been thinking about suicide? Parents, clinicians, we sometimes fail to ask because A, we don't pick up on it, or B, we're uncomfortable talking about it. So it's really important if it's sort of running through your mind, and I think, like, you want to be conservative about, or I'm sorry, you don't want to be conservative about this. If it's running through your mind, you just want to ask. You want to ask your child. You don't want to worry about, like, asking. If it's on your mind, you want to put it out there. I think it's really important.
So when do you think is like an appropriate time for a parent to initiate this conversation?
That's a great question. I probably would do it, when your child seems perhaps most vulnerable or is behaving in a way that's really out of character, and or if his or her moodiness sort of lasts 3, 4, 5 days, then, I would bring it up. Obviously, I would bring it up privately. I would bring it up, like in his or her bedroom, or when, his or her siblings aren't around, and I'd probably bring it up along with like your partner or your spouse, if there is one in the picture.
Mm-hmm. Okay. So you kind of said a little bit about, you told us about the signs, what you should look for, how your child would be acting, and then you said how it should be in a more private setting, so you don't really want to call your child out. They might be more closed in, and they're not going to want to share some more of the information with you.
Right.
What do you think about, like, a school setting or the school environment and the conversation about suicide?
Okay. So this is what you're asking. So are you asking, if you gain the information, should you bring it to the school setting? Is that what you want to know?
That or even just the school talking about suicide in general. Like, suicide is very much a taboo topic. Not a lot of people like talking about it openly.
Right.
But do you think there is some benefit for a school to bring that topic out and to bring awareness to suicide for their students?
Oh yeah. So two things. So first of all, I find, thankfully, that we adults are getting better at bringing it to our kids' attention. We aren't kind of ignoring it or avoiding it because we're uncomfortable talking about it. I think just, unfortunately, the rising prevalence of anxiety, depression, and even suicide over perhaps the past maybe 5 to 10 years has sort of made it mandatory for us to bring this to our kids. So you want to really try to kind of like erase that taboo by bringing it to, like kids, all kids. I mean, kids who seem happy, kids who seem, depressed. The more who know that it can strike any adolescent, the safer the community probably. So that's one. Secondly, I think that, I think one thing I didn't say is if you have the conversation with your child and, your child doesn't want to talk about it, you want to bring it up again, maybe not at that moment, but maybe like a day later or a couple of days later. You definitely don't want to just sort of like this pass if you believe there's something serious up and your child doesn't want to talk about it. The other thing you may find too is when there's a lull in the conversation, when you ask the question and the child doesn't answer directly, that's your cue actually not to say anything, not to sort of like fill in the silence, with chatter, but to just sort of give your child the time he or she may need to then kind of bring up what's really going on in his or her mind. I do that frequently in therapy sessions when it's appropriate, and I find it really works. And I also find that kids are more likely to kind of level with, a parent or a therapist or a pediatrician if there's a trusting relationship which has grown, over time. And then the last thing, just if the child brings it up and tells you, I really have been thinking about suicide. I'm not going to act on it, but I listen, I don't think I'm going to, but I've been thinking about it. I would say that's your cue to ask your child if he or she would feel comfortable having to share it with his or her guidance counselor or academic counselor, and I would really try to encourage your child or your adolescent rather, to go along with that so that, he or she has sort of more support, more built-in support both at home and at school, in case when he or she is at school, he or she finds him or herself extremely stressed and in need of talking to somebody.
Right.
So I try to build that bridge at school.
Okay. Good insight. Thank
Good,
you.
thank you.
So now I'm pulling a little bit more to the treatment aspect, what resources or programs are available for this type of situation that someone may find themselves in. What do you think, or what can be a treatment possibility for these adolescents or individuals who find themselves thinking about suicide constantly?
Okay. Well, constantly. So if you have, an adolescent, or you have a spouse, or you have a friend, or you have a partner who tells you, I do think about killing myself, and I think about it, well, even if they say I think about it once in a while, but, I'll never do it. Again, I may be biased because this is my profession, but I would, argue that that requires a consultation at a minimum with a therapist, so that he or she can kind of weigh in on the question: is psychotherapy, is a more extended psychotherapy program appropriate? If, on the other hand, your friend, your partner, your spouse, your teenager, because again, this isn't always the case, but suicide often doesn't happen among elementary school age children. Kids who are in middle school and high school are more at risk. So if you know of someone who tells you, I think about it a lot, I don't feel like I can really control how I feel or what I think when these thoughts enter into my mind. I've thought about actually doing it. I've kind of imagined myself, for example, suffocating myself, hanging myself. That seems to be the most common way in which teenagers do it these days. Then that really might, require an evaluation at an inpatient program where the treatment is more restrictive, the child is in a safe environment, the treatment is more intensive. That really might be the obvious, or maybe not so obvious, next step, because obviously, we want our loved ones to be safe. So that's, to me, that's sort of the distinction. If it's kind of like a fleeting thought, it's there, that to me is a signal for a prompt for an outpatient psychotherapy eval. If on the other hand, it seems way more serious than that in terms of like frequency, severity, controllability, then I'd probably look to an inpatient assessor, who can kind of answer the question: is an inpatient admission or is outpatient psychotherapy the better next step? Okay.
Thank you.
Thank you.
Well, I'm glad that we got to receive some valuable information on this topic. If you guys would like any more information, you can go to the North Shore Center LLC website, or you can contact myself or Dr. Mazius at admin@northshorecenterllc.com. There will also be more information coming out on the September 2018 newsletter that we'll be also posting to the website.
Thank you, Olivia.
Yeah, you're welcome.